Hello and welcome to Leaders of Tomorrow Town Hall, a series of grand events that we do across the country, ensuring that all parts of the country are covered in our effort to ensure that entrepreneurs like yourself are getting the opportunity to interact face-to-face and directly with our experts. Tonight, we're bringing you highlights of a panel discussion that we did in Delhi, talking about how health startups are creating wealth for entrepreneurs. My colleague Pooja Jain did this discussion. Take a listen to the highlights.
There's no denying that, everyday people are becoming increasingly health conscious. And you'll notice a huge chunk of the market is now sporting wearables to constantly monitor their vital signs, for example. Right? Do you believe wearables, for example, will simply be relegated to a fashion statement, or do they actually have the potential to ease the burden on our extremely fragile healthcare ecosystem?
On this wearables, or let me call it, a recent report called it as miniature diagnostics. I had not read it before. Is it gaining popularity? Yes. Is it gaining popularity because it is hap? Answer is yes. Does it add value? The answer is still yes. Now, I'm not giving a straight answer because these are... see, in the past, unfortunately, at a global level, some tall claims have miserably failed. And as belonging to the healthcare industry, our anticipations get colored by something that we have seen in the past, without taking names. Going forward, will the proportion increase? Yes. Will it substitute to a bigger degree? Probably no. Probably no. The point of care testing will definitely go up. Now, whether it happens sheer by way of wearable devices, cannot predict as of today.
While there's a lot of buy-in around electronic medical records becoming available, for example, or online pharmacies and the convenience of online, there are certain somewhat scary aspects to telemedicine, such as, for example, post-operative remote monitoring of the patient, etc. Right? So as we look to explore these services with more confidence, what exactly needs to happen? Does the consumer mindset need to shift? Do doctors need to essentially rally behind these services to vouch for their credibility? Does infrastructure need to improve? Or is this all in all just not a step in the right direction?
Yes and no. Yes, because it also gives some part of confidence to the patient that you've been constantly monitored, right? In terms of your heart rate, your temperature, your this and that and everything, right? And no, because, okay, you've diagnosed, then what? I believe remote monitoring may be okay for very small, few, select subgroup of patients, right? Now, yes, for example, if you've got a diabetic patient and you're monitoring the blood sugar and the blood sugar drops to 40, you could say, okay, it's dropping to 40, take a sugar syrup, give it to them. So you could do something immediately, right?
Sure.
But what if you see a ST segment depression and you say he's getting an arrhythmia or he's getting a heart attack? Then what? Right? And then the patient assumes and presumes that, you know what, I was being monitored, so I should have been well. So monitoring is different from intervention. And monitoring should be done, would be done, will continue to be done in a very, very select subgroup of patients who would need monitoring and who would give time to the patient to reach the hospital or a technician or a healthcare professional from the hospital to their home. Till we can narrow this gap and make arrangements wherein things picked up can be corrected at home, either by the patients themselves or by the healthcare professional reaching them in time or they reaching to us, there's going to be a big gap there.
Dr. Peters earlier alluded to sort of the very marginalized salaries that healthcare professionals at times receive in this country. And yet on the flip side, the cost of healthcare is staggeringly high. It can push families completely into poverty and cause a lot of financial distress. So what more would you like to see from the government by way of policy support in this arena?
I think it's a very, very relevant, very pertinent question. At the same time, there are no easy answers to this. Let me just tell you, of late we have seen some of the initiatives that have been taken by the government. Those are worth applauding. From my previous life, when I used to run the hospitals, I can tell you, people come from abject poverty. They have to get quality health care to save their life. They have to sell their properties, their everything, you know, the land and everything to get something which is expected to be given by the, you know, the government or the country, right? So we have seen all that, and perhaps that's the reason why the government has become so discerning, and they are now trying to do a bunch of stuff, ensuring the people, at least to the extent of 5 lakh rupee, which is not a meager sum. And the mere fact that the coverage is going to be to 5 crore people, that's a large number. So I think the salaries may be meager. The whole thing is that the kind of ecosystem in which we are functioning, it's all a determinant of what you are earning on the, if I can don my finance hat, what is coming on the plus side and what is going on the minus side. As simple as it's pure economics. If we are charging 100 rupees for a test, which perhaps would command 1,000 rupees elsewhere, and if you're paying almost a similar salary to some senior people as being, so obviously the cookie is going to crumble over there, right? It will not make economic sense. So now the time has come, as healthcare providers, we have to collaborate. Why should we be creating infrastructure which costs monies, which costs huge investments, and kind of fight with each other? I think it's about time. Stop harakiri, join hands, look at the patient, and I think my philosophy is rather simple, Pooja. Whenever my team members are confused, I tell them, put the patient in the center and take a call. Believe me, you'll always come out with the right answer. So I think now the time has come. We have to be investing. The insurance has to be there. See, even today, more than 60% of the people, they pay out of their own pocket, 60% people, for the healthcare requirement. Is it fair? So the whole point is, today we have made a beginning. I hope this continues this way, and certainly the future is going to be far, far better than what we have seen.
The domestic healthcare sector is expected to touch $5 billion by the year 2023. Which subsectors of the market do you believe stand the best chance at receiving funding?
Of the overall healthcare, the lion's share, 80%, sits with hospitals, and that will continue to be. But the sectors where you can see most investment getting attracted and probably most of the young energy rushing into, it is at least looking like going in the direction of telemedicine, teleconsultation. I mean, if we take a stop there, in 2019, this was less than 1 billion USD, and in 2025, as per Niti Aayog report, it will be over 5 billion. That's a growth of over 30%. So, even much higher than any other sector within healthcare. So, telemedicine, teleconsultation will attract funding, and it's already, what you read in the news on the e-farm and e-hub, e-pharmacy and 1mg and all. Other than that, you touched upon IT, data analytics, artificial intelligence, whatever you want to call it, that's picking up very strongly. And the last one on the traditional side, not because I am from diagnostics, so Sanjeev is there from diagnostics, but I believe diagnostics will, because of two reasons, it's a traditional one, but it will attract a lot of, let's say, new things happening, a lot of investment, a lot of new people coming in, consolidation happening, for the simple reason that we have a lot more in the country to do. It's significantly under-penetrated, if I may use that word. Sanjeev talked about the smaller cities, and this will see. I mean, there will be new ways of doing it. There will be new phase, new way of interaction, new way of picking up samples, new way of you seeing the reports, new way of software telling you that if you have these symptoms, why don't you get these 4 tested, whatever it may be. But diagnostics, I would want to have my
Can I
bet on.
just add to this a bit?
Please.
So see, I think he's bang on. Of late, what we have seen is that one is healthcare has a certain charm to it. It's been a sunrise industry for the last decade or so. Just that sun is taking a bit of time to rise, but it will certainly be there in the horizon sometime. But even within the healthcare, diagnostics has become darling of everybody. For the simple reason, the ROIs, ROEs, ROCs are very good, very attractive. It's considered to be an asset-light model where you create labs and then you create collection centers and so on and so forth. It's a very, very credible network you're able to create. And then you are able to pool the samples of the high-end esoteric tests and do that. Mind it, in India, we are charging 1/10 of what is being charged for testing in the advanced countries, in the Western countries. So we are still, I think, there's a huge scope on that side. Also, as Arpan was alluding to it, briefly touched upon that point, the market is hugely fragmented today. If you talk about diagnostics per se, about 47% of the market is in the hands of pop and mom shops. So there are about 125,000 labs in the country, and only about 12,000 qualified MD pathologists, microbiologists, and biochemists. Which means what? Only 10% of the labs have a qualified doctor running the labs. So not much of respect for quality. Now the whole point is consolidation is imminent in such a case. So 47% pop and mom shops, 37% labs are being run in the hospital. Organized chains, whether they're at the national level or the regional level, constitute for only about 16% of the total load. So again, I think the point is that we have to train people adequately, we have to make use of technology, and this sector is bound to grow by leaps and bounds.
I'm going to slip in a short commercial break. On that note, we are back with the Leaders of Tomorrow Town Hall in just a moment. Do stay tuned. Welcome back. You're with us here on Leaders of Tomorrow. Tonight, we're continuing to put the spotlight on our town hall in Delhi, talking about health startups creating wealth.
This forum is really for all of you. We truly consider you to be a part of the extended Leaders of Tomorrow family. So yes, if you have a question, please raise your hand. Wait for a sanitized mic to reach you.
If any patient goes to any hospital, first question is asked from the patient, do you have any panel? Number 2, how much health insurance you are having? And if he tells 2 lakhs or 5 lakh or 10 lakh, the medical treatment starts according to that, and the bill is prepared according to that. So that is one of the very crucial thing. The actual treatment of the particular disease is not known. So this is one of the things. Now second thing is, you have talked about the lab test. Now we are sitting in Delhi. If you go to the villages, I have seen the people sitting on the footpath having a microscope in their hand, and they are doing the malaria test. सुबह आप ठीक हैं, शाम को देखा यार बुखार हो रहा है, ये रोड के ऊपर बैठा हुआ है, और वो आपका मलेरिया टेस्ट 15 मिनट में करके दे देगा. So this is the level of, I'm talking from the village to the 5-star or the metropolitan city. So how you address this? Because this is a gap. You have very correctly said that we have to have more nurses, more doctors, more thing. But this lab is one thing, and my insurance is second question. Thank you.
Sir,
Please.
I will answer both of your questions, sir. When I will give you a very funny thing. Do you know that a cash patient actually pays more in most of the corporate hospitals than the insurance patients? You do not know this. So, right? So when you say that we ask your insurances, when you insurance person pays the hospital, they pay 30 to 20% less than when a cash patient pays. So when you are insured, you're actually giving the hospital less, you avail better facilities. The reason is it's not like if you come for a hernia, right? And I'm giving a very simple example, right? It's not that if you come for a hernia and if you got a 50 lakh insurance, I'm going to charge you 40 lakhs. Those rates are fixed with the insurances, sir. And most of the corporates, these are fixed. So it cannot happen that you can come and the doctor or the surgeon or anyone, X, Y, Z, are going to charge you exponentially because they can charge you or you've got to better this thing. I'm a bariatric surgeon, sir, right? It doesn't mean if you got an insurance of 1 crore, I'm going to charge you 10 lakhs. And if you got an insurance of 5 lakhs, I'm going to charge you a lakh of rupees. No, these are fixed. So this doesn't happen, sir. Probably you got a bad experience somewhere. Secondly, sir, you and me, let's say we are father and son. We are not of that age, but let's say we were in a family. And my family has 2 bedrooms and 2 toilets. And we are 8 people living there. Now, if 8 people get loose motion at one point of time, are you going to make more toilets there? No, you're not going to make. This COVID, right, was coming like a thunder to us. It was absolutely impossible for any of the labs or hospital to go to each place and take samples, sir. It is very easy to sit and say, I called it, they did not come up. Now they're coming for money. It's not that, sir. Please understand, the technician also is leaving his or her family, coming to a patient who is exposed of COVID at that point of time and taking their chances. So when a pandemic like this hits, it will be difficult for even the best of the countries of the world, the most developed countries of the world who have the best of the healthcare system, even they shattered down. We were still doing very well, sir. We should appreciate that we still did very well.
So just to add, you see, sir, this trust deficit has to go. Believe me, we are all, good people, so to say. I mean, we come from good families, most of us. We are taught the same value system. And when you're dealing with a company or an organization where professionals are running it, let me just tell you, there's no ulterior motive. People only get paid salaries. There's no motive to do anything hanky-panky. One, let me just tell you, for the first time in my life, I felt so vulnerable during the second wave. There were no beds. We worked, believe me, none of my team members did less than 38 hours of duty every single day. We had to rotate people. I lost a few of my colleagues. I was to go abroad to meet up with my family, but I couldn't. Because that was the time I was booked, but I couldn't because I couldn't have afforded that. I've seen people, like falling like 9 pins. So I think, I quite agree with Dr. Peters. I think we need to be, kind of a little more soft on the guys. Believe me, we are a very rare breed, so to say. Very few people. I told you only about 12 lakhs doctors to manage the load of, 135 crore people. And so is the case with, I told you about lab technicians or, pathologists, only 12,000 pathologists vis-a-vis. So I think the point is that you should be going to people whom you can believe.
I'd like to understand how open you are to sharing your knowledge so that others' ideas being incorporated. As a technologist, I understand medical instrumentation, which Siemens is already presenting, biomed, robotics, all this part of it. Now tell me if I am to understand, where is the source? And second part is that how the regulatory is controlling you. Because you mentioned that you have an ombudsman in your own individual corporate hospitals. They have their own policies. So I'd like to understand, if I want to understand something, where should I go?
I think we are the ones who have been clamoring from the rooftop. There has to have some regulation. So who's worried about regulation? People who do not want to play the game by the rules. We are all for regulations. Now, regulation doesn't essentially mean only price capping. Okay, it's a free country, free world. I think we should respect. My costing could be different than his. If I am having a DM hematologist vis-a-vis somebody else having just a technician, I'm going to charge more for that, right? So regulation is a must, and what we are doing is we have made one small step in that direction. We have been through various forums, CII, Nat Health, FICCI, ASHOCHM and all. We have been telling the government or that, we have got this body called as NABL or NABH, right? Where the assessors who are picked from everywhere, from hospitals, from labs, they become assessors because they don't have a workforce of their own. They go as invigilators or assessors and do the audit of that particular lab or a hospital. Now, there are now, post-COVID the numbers has increased, but pre-COVID the number of accredited labs was only 1,200, which is 1% of the overall labs. So the least we should do is, on our own volition, we should go and get the lab accredited. Or as customers, we should go to the labs which are accredited. Otherwise, what will happen? People who are flouting norms, people who are not worried about regulations and all, if we start going to them, obviously, I mean, there's no stopping there. Now, coming to how open are we to, sharing the information, it depends on what information you want, right? I mean, it can't be arbitrarily. I can't say, oh, come and look at my books. I mean, that's a prerogative only of my auditor, right? I mean, I can't be, so it depends as to, and obviously, we meet up with, as I'm running a company, so obviously we meet up with hundreds of people. We're very, very open to meeting up with people who are coming with meaningful ideas. After all, we have to run a business. After all, we have to run a business efficiently and effectively, right? I mean, it's all about creating value. If we have to create value, we have to be, working with people who can actually add value to it. Why should anybody be close to that?
I have to thank all of our panelists for sharing such a rich range of perspectives, insights, anecdotes from their personal and their professional journeys. A huge round of applause for them, please. I believe it's deeply deserved.
That caps the special two-part series that we've been doing from our Delhi Town Hall series talking about health startups creating wealth. If you have any feedback for us, do let us know. Our contact details up on your screens as we speak. Thanks for watching. Have a good night.